Emma McBryde, we've had the Queensland government say it's actually running out of Pfizer vaccine, and other states saying that they're reporting shortages. Is it possible that we'll actually see lower rates of vaccination with Pfizer between now and those extra vaccines coming on stream?
It seems very possible, and I think what we need to have is somewhere where that information is made available to Australians about when the next Pfizer is arriving and how much is sitting unused in the country. We just don't have access to that, and it's time we did as a country. And particularly people who are thinking about getting AstraZeneca under 60, that's part of the informed choice they have to make. They have to know when Pfizer might be available for them.
You've done some modelling on what has to happen in Australia, and you argue that the plan that was announced on Friday is based on the idea of herd immunity, which would require 80 to 85% of the population being vaccinated. How long would that take on current vaccination rates?
Well, at the current rate of 125,000 a day, we wouldn't be done this year. The other thing to consider is, will we get there at all? At the moment, if you look at different surveys, there's quite a group of people who have no intention of getting vaccinated. There's another group who are waiting to see, and we really need to ensure that those people have the right communication, right messaging to make an informed choice about that.
Should we actually be trying to reach that figure before we open the borders?
Well, that's a huge question. My personal view is herd immunity isn't an all or nothing thing. We can do our best to get to herd immunity. We can offer everyone an opportunity to become vaccinated if they wish. Now, so herd immunity is about ensuring that there's essentially no risk to people vaccinated or unvaccinated of getting COVID. It's so small that it's negligible. But there's also the direct effects of vaccine. We know that being vaccinated makes you, a tenth as likely to get really sick with COVID, and maybe even a 20th as likely to go to hospital and die from COVID. So those effects will happen whether we reach herd immunity or we don't reach herd immunity. So perhaps when everyone's had an opportunity to be vaccinated who wants to be, that risk may be a manageable risk, and it will certainly take the burden off the health system if we can ensure that the majority of people, particularly the most vulnerable and the over 60s, if the majority of them are vaccinated, then we may be able to open up our borders even without herd immunity.
Should governments be doing more to sort of positively discriminate in favour of the vaccinated as an incentive for people to get vaccinated, i.e. giving them more access, as has happened in other countries, like in the US and the UK, to some services and public functions?
Yeah, look, I've been calling for this. I think it's really important. It's an incentive. It will help lift the numbers who are vaccinated. But even beyond that, it's also a sensible, reasonable risk stratification. If you've been vaccinated, you are just much less likely to have COVID. And even if you do have it, you're less likely to pass it on. So it's only sensible to stratify people by that risk. For example, I can't see why fully vaccinated people shouldn't be allowed to travel interstate with far less impost on them in terms of quarantining than unvaccinated people. Why put them in a hotel quarantine when a simpler way would be much more sensible? And similarly, why shouldn't fully vaccinated Australians be allowed to leave Australia?
You've also said that if we were being really strategic about the vaccination rollout, we'd be vaccinating 90% of the most highly transmitting group, which is actually between 20 and 60, which is the one group that we're not vaccinating at the moment.
Precisely, yeah.
Is there any? How do we change that?
Well, we open up vaccination to all age groups who are eligible is how we change it. But I can understand that that's very difficult to do when supply is such an issue. So we've got to do something about supply. But I think now everyone over 60 has had an opportunity to be vaccinated. I think it's time to open it up to all age groups and just trying to get people through the door. But I think the reason why that hasn't been done is because we don't have supply. And if we open up too much, it'll be so obvious that we don't have supply. It'll look like kind of a run on the banks where there's just nothing left.
And do you think that's why the Prime Minister was encouraging people under 60 to consider AstraZeneca?
I do. I think that there's no reason to consider AstraZeneca if there's plenty of Pfizer about. So the reasons. So my view is AstraZeneca is a good vaccine. Pfizer is the preferred vaccine, but both of them are better than nothing. And if your option is nothing, then there's no reason why you shouldn't consider, with consultation, having an AstraZeneca vaccine. But you wouldn't do it if you're offered Pfizer. So it's as simple as that.
Professor Emma McBryde, thanks so much for joining us this evening.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.